Good morning, guys. Today I'm taking going about pelvic fracture. Already I told for joints and what are the bones and ligaments and all. Already first year class anatomy is finished. Anatomy physiology. So kindly go through that. If you are not go through that one, you can learn for practical. Then you can learn for anatomy physiology, because IM injection and all, which one we are assess and giving, that is and all everyone knows, right? So kindly go through that one. So what is the pelvic, which are the pelvic injury? It means falls, high speed vacuum cleaner, crush injury and all. Then anatomy of the pelvics. So one sacral bone, two innominate bones for pubics and ilium and ischium. So symphysis gap for less than 5 centimeter. Then here first view U shape is the sacrum. So sacrum to iliac, then he symphysis to iliac. So that force acting to the pelvic structure and direction and replacement of underload. So what are the pelvic ligaments? So it's a ligament give the stabilities. So anterior give the external rotation. So sacro spinosis given for resist external rotation. So posterior sacroiliac and all, they provide stability and tension pain and strongest in the body. Then sacrotuberous, so shear and flexion to the sacral joints. Then possible of bleeders means sacral venous flex, iliolumbar and internal iliac and superior gluteal. So superior gluteal and all, you know the muscles, okay? So lateral sacral and pedonatal. Okay, so visceral anatomy. What are the visceral anatomy means? So this is uterus and bladder and urethra and vaginum. So under the only for pelvic will be there. So image. So anterior post pelvic during the early phases to restriction of the useful determine the presence and absence of the unstable pelvic fracture. So if you know means any this is for the normal. It's a this is symphysis pubis, ischium, pubics and sacrum, iliac. So what is there means, if your presence or of absence of any pelvic fracture, if your yearly phases means we can resuscitation. So anterior posterior pelvis can identify that 90% of pelvic injuries. So here that image, so patient will lie down. This is a sacrum view. So that projection they given for this upper that to brim, it's like pelvic brim. So evaluate the posterior displacement and evaluate rotation of sacral and iliac impaction of the injuries. So here they will for elevated. Okay, so if you are lie down for 45 degrees cephalo tilt and vertical shift of the pelvics, so provide the better demonstrations of sacral fractures and sacral joints. So next is CT scan. CT scan is normal but visualization of the sacrum and the joints and rotation of the posterior displacement of easily accessed. So what are the classification means? There is a three type of classification. So first, that up is a pelvic ring stable, then down middle is a rotational unstable, it's a vertical, and C is rotational and vertical unstable. Okay, so here young and Berger classification means, so lateral compression will be there, anterior posterior compression will be there, and vertical shear will be there, and component mechanism will be there. So initial assessment what we can do, have a maintenance for spine protection, then breathing and ventilation, circulation for hemorrhage control, and disability for neurological status, and exposed environment to control the prevent for hypothermia. Then physical examination, neurological deficit involving to lumbar sacral flexus. Then what means, that is a full lumbar, it will be connect to brain, right? So it will be there for neurological deficit. Then patient also, if affected pelvic bone, they count to stable to stand. Then pelvic flank perennial contusions, ecchymosis, oppressions. So here that ecchymosis means, so that one for it's called for discoloration of the skin resulting for the bleeding. So that is ecchymosis. Then oppression means damage of the skin. Then blood in urethral meatus. and bleeding around the rectum, open wound, groin, buttocks, and perineum, leg length inequality, and external rotation of the extremities, abnormal pelvic portion to on anterior posterior and lateral compression of anterior iliac spine and iliac crestis. So, what are the next neurological exam? Okay, first one rectal exam for tone, then bulbocavernous reflex. So, what is the bulbocavernous means? It's a somatic, I think somatic nerve everyone studied, okay? That somatic reflex that jointly information about the state of the sacral spinal cord, okay, segment. So how it will be checking means that gently tapping the silitrosis with the cotton, then observe the contraction, so that reflects like this only they will check. Then myotomies for lower extremities, so hip flexors and quadriceps, knee extension, ankle and toe dorsiflexion and ankle frontal flexion, then